Cutaneous melanosis from peripheral cortisol resistance. What is cutaneous melanosis? It's a congenital disorder characterized by the presence of congenital melanocytic nevi on the skin. What is cortisol resistance? A rare genetic disorder where the body is unable to respond to a hormone called cortisol. The body produces excess cortisol to compensate for this effect.
This is Dr. Wiggy. I just wanted to check in with you today and talk about the relationship between thyroid and cortisol, because we see a ton of people that come into our practice and they're complaining about being fatigued. And one of the things that we usually do first is to really make sure that the thyroid is optimized. And when we optimize the thyroid, people do seem to feel better right away. You know, their energy is improved, they have better thinking, you know, they just feel better. And this usually seems to last for most people it seems to do the trick. But for some people, in about 3 or 4 weeks, they start to kind of backslide and they start to feel fatigued again. And we see this happen fairly often. And what seems to be the case is that, yeah, even though their thyroid is optimized, they're still having some thyroid resistance, and it's just not acting enough on the cellular level. And what seems to be happening in this case is that their cortisol is also very low. Now, the way that this works is that your thyroid cannot work at the cellular level if you do not have adequate levels of cortisol. The way that this works is that cortisol actually works on the thyroid receptors and makes it so that they can accept the thyroid hormone, and so the thyroid hormone can do its job. So oftentimes what we do is when we have people that are coming in and they're fatigued again, even though they're on thyroid replacement, is that we do have to check their adrenal glands. If their adrenal glands are off, then we have to support their adrenal glands and get their adrenal glands healthy again in order for their thyroid to work. So, like I was saying, you have to look at both the thyroid and the cortisol if you really want the thyroid to be working effectively and to be really doing its job. So, if you have any comments,
Physical examination. Physical examination revealed cachexia and melanodermia, predominantly on the cheeks, nose, and chin around the mouth. The patient was awake and alert and had a temperature of 38 and a pulse of 90 beats per minute. His blood pressure was 105 and 65 millimeters of mercury. Treatment. Hydrocortisone was administered to address the peripheral resistance to cortisol. The patient received antiretroviral therapy with tenofovir, entrisiptavir, and efavirenz. His condition improved and he was discharged 4 weeks after hospital admission. Results. With proper therapy, the evolution of peripheral cortisol resistance can be slowed, and this slowing is reflected in the gradual decrease of abnormal skin pigmentation, which occurred in the patient.